If you're searching for hyperbaric oxygen therapy Sarasota, you're probably already tired of the usual standard of care routine: 5 rushed minutes, 1 recycled diagnosis, and a prescription pad doing all the heavy lifting like it deserves Employee of the Month. That's not medicine. That's paperwork with a copay. At ARTC, I take a different approach. I look at physiology, oxygen utilization, tissue repair, and whether your body is moving toward regeneration or drifting into degeneration. Hyperbaric therapy is not a spa gimmick for people with too much free time and a coupon code. It is applied physiology. When oxygen delivery improves under pressure, cellular performance changes, repair changes, recovery changes, and inconveniently for the assembly line model, outcomes can change too. I'm the digital avatar of Dr. Max MacCloud, aka the Nutrition Ninja Doc. His passion and purpose are to solve health problems to help people achieve their health, performance, and appearance goals. He utilizes AI to save time, allowing him to spend it helping others. With over 45 years of clinical experience, he has acquired extensive specialized health-related knowledge that he wants to share, which is why he produces videos. Please note that this is not medical advice. It is for educational and entertainment purposes only. Consult your trusted progressive healthcare provider before making any significant changes in your health regimen. Now let's get back to today's topic, but before that I ask you to please hit the like button if you find this information helpful. Subscribing to this channel helps get this information to more people. Hyperbaric oxygen therapy, or hbot, places the body in a pressurized chamber while you breathe concentrated oxygen. That extra pressure matters because it dissolves more oxygen into plasma, not just red blood cells. In plain English, oxygen can travel farther, reach compromised tissues more effectively, and support repair where circulation has been underperforming like a government contractor. That shift in oxygen availability is one reason hbot has been studied for wound healing, inflammatory regulation, neurological support, and metabolic recovery. A review indexed on PubMed discusses how hyperbaric exposure may influence mitochondrial function and cellular energetics. That matters because energy production is not a side issue. It is the issue. Your mitochondria are the engines inside your cells. When those engines sputter, tissues heal slower, inflammation lingers longer, and brain performance starts acting like it's buffering on dial-up internet. hbot may help support mitochondrial efficiency by improving oxygen delivery where it is needed most. That is not magic. It is pressure, gas exchange, and basic biochemistry doing what they were designed to do. At ARTC, I don't treat oxygen like a generic commodity. Dose matters, timing matters, pressure matters, context matters. That's why a personalized strategy beats the lazy one-size-fits-all protocol every time. Biology is individual, even if the healthcare system keeps pretending humans are made on the same assembly line. Recovery is where hyperbaric oxygen therapy Sarasota starts to separate serious regenerative care from glorified symptom management. More oxygen available to damaged or inflamed tissue can support healing responses, circulation, and post-exertion recovery. That matters whether you're an athlete, a business owner running on fumes, or just someone who would like to walk up a flight of stairs without sounding like an accordion in distress. Research has also explored how hbot influences tissue repair and inflammatory signaling. A study available through PubMed examined stem cell mobilization under hyperbaric conditions, which is part of why this therapy gets serious attention in regenerative medicine circles. When the body has better access to oxygen and repair resources, recovery tends to stop dragging its feet. This is also why I integrate hbot into broader regenerative planning instead of pretending one tool solves everything. When appropriate, we connect therapy to deeper evaluation and support systems like the Mitochondrial Longevity Link and our full hyperbaric oxygen therapy program. Tools work better when there's an actual strategy behind them. Shocking, I know. Your brain consumes a disproportionate amount of oxygen for its size, so when circulation is compromised, inflammation is high, or metabolic efficiency is low, cognitive performance can drop fast. Brain fog, slower recall, poor focus, and reduced mental stamina are not personality traits. They are signals. That is one reason hyperbaric oxygen therapy Sarasota keeps showing up in conversations around brain health and functional resilience. Evidence continues to develop in areas such as neuroplasticity, post-injury support, and age-related decline. One recent review on PubMed highlights mechanisms involving blood flow, inflammation, and neurological recovery. Translation: the brain likes oxygen, and pretending otherwise is not a treatment plan. If your goal is sharper thinking, better resilience, or improved recovery after physical and cognitive stress, hbot may be a valuable part of the equation. Not because it's trendy. Because the brain is metabolically expensive tissue, and expensive systems tend to malfunction when you short them on fuel. Let's clear something up. Anti-aging should not mean chasing some cartoon fantasy of looking 23 forever under flattering lighting. It should mean protecting function, resilience, recovery capacity, and health span. Most of what gets called normal aging is really managed decline with a nicer brochure. Hyperbaric oxygen therapy. Sarasota has gained interest for its potential role in supporting healthy aging, because oxygen availability affects repair, inflammatory balance, and cellular performance. If you want to learn how this fits into a broader clinical framework, explore our most popular programs and services. Because no, the answer is not another random supplement bottle with flames on the label and a promise written by a copywriter who has never seen a lab panel. At ARTC, I don't just put people in a chamber and hope for the best. I assess the bigger picture: energy production, recovery reserve, inflammatory burden, functional goals. Treatment should be targeted, measurable, and adaptive, not decorative. That means our process is designed around clinical context, understanding what is driving dysfunction instead of chasing symptoms around in circles. Customized protocols, matching pressure, frequency, and therapy planning to the individual rather than a laminated script. Regenerative strategy, integrating hbot with broader programs that support recovery, resilience, and long-term performance. The truth is simple. You're either moving toward regeneration or toward degeneration. There is no magical neutral setting where bad habits, poor oxygen delivery, high stress, and declining tissue function somehow average out into vitality. That fairy tale has sold a lot of memberships. It has not produced much health. If you're tired of the usual treadmill of symptom management and want a smarter, more deliberate approach, ARTC is built for that conversation.